Hey everyone, I'm Dr. Rob Assibey, Associate Program Director at San Joaquin General Hospital Family Medicine Residency Program, and new Physician Director here at California Academy of Family Physicians. And we know that addiction medicine is family medicine. Did you know that only 1 in 5 people with opioid use disorder receive treatment? We'd like to change those odds. In our latest series, we bring you stories of doctors and their patients who have worked together to reduce the harm done by opioid use disorder. These brief stories will bring you into the hearts and the minds of our guests. We hope that this will inspire you to do everything in your power to bring medical attention to the opioid use disorder patients in your practice. I'm so glad to be with my friend here, Dr. Tipu Khan. Dr. Khan, you have been working on this 1 in 5 series, interviewing 5 different family physicians about how each of them have approached caring for patients using MOUD. Now, you want to tell me a little bit more about the conversations you've had for this series?
Yeah, thanks, Rob. I think it's been really exciting to be able to talk to frontline physicians that are on the ground in different locations, right? Everything from the emergency department to primary care clinics to medical directors, and really summarizing how they approach this problem. Because in the end, OUD affects our patients everywhere, and we interact with them all the time, no matter what setting you work in. Family physician in urgent care, in an emergency department, in a primary care setting, an FQHC, a private practice. We're all seeing these patients, including in the hospital. One interesting fact is in 2016, about 1% of primary care patients had OUD. That's about 1% of your patient panel. But what's really, really scary is that only 1 in 5 people with opiate use disorder actually receive the evidence-based treatment that saves their life. One of the interesting facts with the medication buprenorphine is it's got a number needed to treat of 2, meaning that you need 2 prescriptions to have a good outcome. And I think back to other meds we use all the time in primary care, right, Rob? Like statins we use all the time for primary prevention, 1 in 60, 1 in 200. I mean, these crazy number needed to treat. And yet we've got a medication that's a number needed to treat of 2, and only 1 in 5 people are getting it. So through this podcast, we journey through interviewing how you can integrate this practice and this standard of care into your setting, no matter what that setting is, as a busy family physician.
Thank you for that. I think you touch on something very important. One thing I really liked about this series is that it normalizes the treatment for MOUD. It's something very easily that we already do, just like you said, bringing statins and our diabetes care, all these things that we're already doing and normalizing. This series really highlights that any single one of us family physicians can do it in any different setting, which I think makes it a lot easier for us to sit with it and be able to use it in our day-to-day practice.
That's awesome, Rob. I'm really happy to hear that. That's exactly what we were shooting for with this series. And you kind of led us off with that quote of family medicine is addiction medicine. I love that. I use that all the time. And you'll hear that throughout this podcast series. And I mention this to my trainees all the time in my residency and fellowship, is that addiction medicine really is just good family medicine. So I'm happy to hear you felt that came through on this series.
So we kick off this series with Dr. Gloria Sanchez, which is really, really special. I actually had the opportunity of meeting her for the first time at last year's Addiction Medicine Conference, and she has so much knowledge to share. Tipu, can you tell our listeners why the episode is one to listen to and share?
Yeah, Rob, this is a great episode. First off, I really look up to Gloria Sanchez. She was one of my faculty when I was a resident, and it's really humbling now to be in the position where I can interview her as a colleague. And she brings a really great example of the high-risk, vulnerable patient we take care of, and that's the pregnant, addicted, and poor patient. And so she really highlights how intervening in someone's trajectory of disease, especially when they're pregnant or recently delivered, how that can really change their outcome, not just for themselves, but also for their child, their family, etc. So it's a really great opportunity for us to walk through a patient that Dr. Sanchez took care of during pregnancy and what happened afterwards with appropriate medication-assisted treatment.
That sounds amazing, Tipu. Like, honestly, big thanks to you for doing this series. I don't know if everyone's ready to get started, but I'm ready to get started. So let's listen to the first conversation in our series, 1 in 5, increasing the odds for OUD patients.
Thanks, Rob. Here we go. Hi, I'm Dr. Tipu Khan. I'm a family physician and an addiction specialist. Today, we're really lucky to hear from both a patient and her doctor as they talk to us about their journey through management of medications for opiate use disorder. Jessica, thank you so much for being with us today. Would you please introduce yourself and tell us how you came to see Dr. Sanchez?
I'm Jessica, and I was on fentanyl for about 4 years, a large amount of fentanyl, and I became pregnant and knew I couldn't quit by myself, and that's what brought me to Dr. Sanchez.
Dr. Sanchez, can you introduce yourself and tell us a little bit about your work and how you got to meet Jessica?
Yes, I'm Dr. Gloria Sanchez. I am very excited to be here as a family medicine doctor who also specializes in addiction. I feel like addiction has been always part of my family medicine path, and it's been a privilege to be able to help our institution really make it feasible to offer treatment at any portal. So that means the emergency room, labor and delivery, inpatient, and our clinics.
Wonderful. Thank you for that. Jessica, you had mentioned that you had been using fentanyl prior to meeting Dr. Sanchez. And we know that most of our patients with an opiate use disorder have multiple episodes of treatment, and it takes a few times to really get this under control. What was different about your encounter with Dr. Sanchez that changed the trajectory of how your opiate use disorder was managed?
She didn't just treat me like another patient. She treated me with care, and you could see that she had love for what she does, and if I don't call her, she calls me. So that helped out a lot too.
Gloria, can you tell me a little bit about your interactions and how you managed treating Jessica's opiate use disorder throughout your clinical encounter and what was different or special about this case?
I really think it helps to have the support from my colleagues in obstetrics who also help create the environment of low barrier MAT. If the patient, like Jessica, really wants to start Suboxone, then we do everything we can to facilitate it. So I think having the support of everyone on the labor and delivery floor, and I hope that's how you felt, Jessica.
Oh, absolutely.
I help patients in any setting. And with Jessica in particular, I really feel so fortunate that I could come and talk with her. That's really key, doing face to face and just trying to make sure the rest of the team, they were on obstetrics, really supporting what was going on and also helping make sure we do a lot of check-ins, even though I know, Jessica, you were really uncomfortable at the beginning, if I may. But we tried hard to get you as comfortable as possible. It's such a privilege to still get to know you now. And for me, just listening, that's part of the magic.
It sounds like the two of you really built a lasting and wonderful relationship as you were getting your opiate use disorder managed during pregnancy. Jessica, can you tell me a little bit more about what's happened since you met Dr. Sanchez and you've been on treatment? Have you delivered? How's your baby? How are you? Tell me a little bit more how things are going now.
Well, in the beginning, it was rough. I decided to go into treatment, go into detox actually fairly early in the pregnancy. I still went a little bit later than I should. And then upon having her, I was already on MAT services for so long. The state didn't get involved. It was definitely a journey to get the right dosing. But once we got the right dosing, it's been great. To be honest with you, I have no cravings, no thoughts. And then even when it came time for the baby to come, I feel I was still on the right dose, you know what I mean? She said we could either give you more or less depending on how you feel, but we stayed with the same dosing and the baby came. She was healthy. I still have her with me today, and if Dr. Sanchez didn't intervene in my life like she did, I don't think I'd have my baby. But yeah, things are going really good. I've been in treatment for 5 months now, so that's been helping too. I can't believe it's already been that long. That's crazy. I've been seeing Dr. Sanchez since mid-July, and she's a big part of my recovery story.
Wonderful, Jessica. Thank you for sharing. That's just absolutely touching. And it just really emphasizes how much of a role we as family physicians can play in our patients' lives. And it's more than just a medication, right? It's building a relationship. So we as family physicians are really uniquely placed in being able to manage both baby and mom. Gloria, can you tell me a little bit more about how things are going in terms of management of the family unit?
Yes, that's the other privilege of this relationship with Jessica is just being able to move on to the next chapter and see Jessica in clinic for full spectrum care, not just MOUD, and her beautiful baby who is doing so well. So that's just another part of this. And for me, I do feel like it's just part of being a family med physician. It's a 360 perspective. It's not just about the MOUD, it's about everything else. And most importantly, about achieving your next goal. Life is difficult. And I feel like one of the privileges of family med physicians is that we really can take those instrumental steps. Even if there's a few steps backwards, you keep looking forward to helping that person achieve the next thing.
Gloria, can you tell me a little bit more about what that relationship has evolved into?
Thank you, Jessica. It's always such a privilege to just partner with you and your baby now and really just advocating and trying to help you in your amazing recovery that continues today. And this is where I want to really speak to all the family med physicians that haven't experienced this, because for me, treating people who use is such a gift and such an amazing process. And it's so feasible. It takes the passion of family medicine doctor already comes with, and partnering with patients like Jessica who are ready and need help, trying to slow down, stop, whatever the word is. I really try to listen to where the patient's at and keep building on where they want to go. And we as family physicians have an amazing skill set and experience that allows us to really change lives, communities, and the trajectory we see right now in the era of fentanyl. So one of my biggest messages is that please try, and you may not be the long-term MOUD provider, but at least make it as feasible as possible. Give that first prescription. And if you can't continue, then please find someone who can, because partnering with people like Jessica and helping her achieve her goals as a mother is just such a gift. So I really hope that this helps some people give it that first try and keep trying.
Thanks, Gloria. That's such a great way to think about it. And you're right. We should be empowered to give that gift. So we really should write that first prescription. We can figure out where they go next, but please get that first prescription written to get them started on the journey of stability. So, Dr. Sanchez, it can be intimidating for a lot of physicians who haven't done this before to write that first prescription for medication for opiate use disorder. How hard was it, or how easy was it for you to manage Jessica in a busy primary care practice?
I think if I had met Jessica a couple of years ago, it might have seemed more difficult just because I hadn't had as much experience, just like anything new. But I think that it's so feasible. I just really want to encourage people to try. And there's so many lifelines now where you can call and get help if you're not exactly sure what to do. And the thing that's so amazing is that for the first time in my career, I feel like there's an equity issue. There's so much to be said about treating problem number one, which is use, whatever that may be, alcohol, opiates. Instead of just referring out, we can treat that now as well. And I feel like family medicine physicians are perfect and probably, dare I say, better at trying to do this because we really know how to look at the long-term continuity of someone. And this isn't just a referral basis. So I really feel like the reward of creating equity for a very treatable condition like use disorders is what also is, I'm hoping, speaking to family med physicians, in particular in this era of fentanyl, when we really have a crisis going on where someone who uses, I'm really hoping number one is offer them Suboxone so that they can make it to the next day and know that it's really a very different environment than before. So really trying to get more comfortable in making that prescription. And it doesn't take that much more time. I know that's always a problem we have in our continuity clinics, but it's so rewarding. And my hope is, and in 10 years, we'll look back and say that family medicine physicians took the lead on the opiate use crisis that's going on.
Gloria, one of the things that we struggle with as busy primary care docs is how do you incorporate this new skill set into your practice? You've got 12 or 14 patients in a half day. You've got to just churn through these numbers to keep the doors open. How do you slow down your flow or bring in a new patient for a new problem when you've got a lot going on already? And does it make enough money for the clinic or for the system or productivity to allow you to justify taking care of these patients? What are your thoughts?
I do feel for our colleagues that work in a system that quote unquote don't get it or make it, it is hard if you don't have some support. And I'm talking at all levels, from the security guard to the pharmacist. I think really finding advocates who help you create low barrier MOUD, non-stigmatizing care takes time, perhaps. And I hope you're in a place where it's just there. But I feel there is really great resources to help you teach your institution or your supervisors how the fiscal argument for treating MOUD is so strong and that they can't afford not to include this type of care in their busy primary care clinic. And things like drug Medi-Cal waiver reimbursement is another way that does help some clinics create these spaces and the finances needed to treat patients. So I really feel like we're slowly getting there to really help our payers, quote unquote, understand they can't afford not to treat MOUD or any other substance use disorder like alcoholism. So it's a very exciting time to partner with administrators, pharmacists, nurses.
I love what you said there. We can't afford not to treat. That's the take home, 100%. And I think that's exactly what we need to hear as primary care docs, that this is very doable, even as a new skill in a busy primary care practice. Jessica, just any closing thoughts that you'd like to share with our family physicians that are listening in, and anything you'd like to add or have us take home with us as we manage patients who come through our door like you?
One thing that really helped me is that I got on the Suboxone right away. I didn't have to get referred out, because people that get referred out, what am I going to do right now? And then they go out and use more and then forget that they got referred out. So I was just thankful that she was able to treat me right away when I wanted to get treated. And then Dr. Sanchez, she's not just a doctor to me. She's Gloria. She's my friend, you know? I'm so thankful for her. She's been a godsend, really.
Well, thank you, Jessica, for sharing your story. It's always so humanizing to be able to hear the impact we can make. And Dr. Sanchez, you've clearly made an amazing impact on Jessica and her life. And I can hear the emotion and love between the two of you. So thank you so much for taking care of her. When we look at these patients, we realize you can't be more stigmatized than being pregnant, addicted, and poor in society. And we as family physicians really are uniquely trained to manage that mother-infant dyad struggling with the use disorder through pregnancy and beyond. So I really challenge all of you listening out there to be the catalyst in changing a couplet's life and the familial trajectory for generations to come. Thank you for listening.
Can I add one thing to that?
Of course.
I just wanted to say my daughter's going to get to grow up seeing me sober. And that's something that I'm going to cherish.
Oh, how wonderful.
You said it, Jessica. You got this. You got this.
Thank you so much, Dr. Sanchez, Jessica, and Dr. Khan, for speaking from the heart about your experience with opioid use disorder. CAFP is truly honored to share your story. If you're looking for resources on MOUD or substance use disorders, check the show notes at familydocs.org/podcast or visit CAFP's substance use disorder webpage at familydocs.org/SUD. If you're looking for family medicine peer to walk with you as you begin to incorporate MOUD, you can link to our MOUD champions on that same page, familydocs.org/SUD. This is our second series focusing on family docs and opioid use disorder. If you missed our first series, you're really seriously missing out. Find it in your podcast player by viewing all Family Docs podcast episodes. If you enjoy our show, please rate us and review us on Apple Podcasts, and be sure to come back next time for our next discussion of family docs working with patients with opioid use disorder. Until then, this is your favorite family med doc, Dr. Rob Assibey. This podcast was created, produced, and recorded by the California Academy of Family Physicians. The Family Docs podcast series 1 in 5, Increasing the Odds for OUD Patients, is supported by the California Department of Healthcare Services. The views and opinions expressed in this program are those of the speakers and do not necessarily reflect the views or positions of any entities they represent or the California Academy of Family Physicians.